Thank you, Chair. Thank you, Minister. And thank you to your staff. My question has to do with a comment in your opening remarks. You talked about foreign credential recognition. I would like to hear you talk a little bit more about the roles of the federal government and provincial governments on that file and how you could continue oversight of foreign credentials. Thank you for that question. As you noted, this is ultimately up to provinces and territories. Under the Constitution, they are the ones tasked with the criteria for practicing as a health professional, for example, a doctor or a nurse. Often, this regulatory work is delegated by provinces and territories to professional bodies. But it is the ultimate responsibility of provinces and territories. The Government of Canada works in close collaboration with the governments of provinces and territories on questions related to immigration, which of course relates quite closely to foreign credential recognition. So we are working with provinces and territories on ways to make people's arrival in Canada more smooth. In doing so, we hope to facilitate foreign credential recognition so that people don't have the chance just to come to Canada, but to serve their communities through their talents and to serve OLMCs, because they could certainly play a role in OLMC health. At the end of the day, it's a work of collaboration. We could look at what's been going on in the Atlantic provinces. They noted that they would be setting up a regional repository of doctors. We could perhaps do something similar on a nationwide scale. Maybe provinces could then sign up for that initiative. And it could also be expanded to other health professionals. Thank you. My next question has a little bit more to do with the health transfers that you recently negotiated with your provincial counterparts. Some conditions have been attached to the transfers. Could you tell us a little bit more about these conditions? So there's 3 of them. First, respect for jurisdiction. The government respects the fact that it's provinces that are in charge of, for example, hospitals and professional bodies. Second, responsibility. We all have the responsibility to take care of the same people. The third is results. We've learned a little bit from the 2017 process for mental health, community health, home care. But we can go farther than that. For example, we could ask provinces and territories to provide plans stating how they would invest additional funds from the federal government in which priority areas. The priority areas that we established include mental health and better data management. We will also establish a series of timelines and targets. So, for example, targets for people with a family doctor. And in doing so, we could look at remote regions, OLMCs. And there will be reporting mechanisms so that we can tell whether provinces and territories have met their goals and their deadlines. Okay, so the targets are provincial. Yes, provinces set out their own targets. The timelines are 3-year timelines. Because that is the first stage of our action plan. So within 3 years, we should see some progress towards better access to family doctors, for example. Thank you, Senator.